Hello, and thanks for listening to the MiCare Champion Cast. With May being Mental Health Awareness Month, this episode will explore how Michigan hospitals and healthcare teams are adapting to virtual care delivery in the behavioral health space. Along with that, we'll discuss some of the latest trends and learn how one of our member hospitals in West Michigan is responding to the mental health needs of both children and adults. Here to lend their insight and expertise are two clinicians from Pine Rest Christian Mental Health Services. As the third largest nonprofit mental health care provider in the country, Pine Rest offers a full continuum of care for mental health and substance use disorders. In addition to their outpatient locations, Pine Rest has a state-of-the-art psychiatric urgent care and, as we'll learn in today's episode, a soon-to-be-built pediatric behavioral health center. With that, I'd like to welcome our first guest. Dr. Heide Rollings, in addition to being a child and adolescent psychiatrist at Pine Rest, is an assistant clinical professor in the Division of Psychiatry at Michigan State University. Having been in the field for nearly a decade, Dr. Rollings has experience in inpatient, partial hospitalization, outpatient, and residential treatment settings. She also serves as the program director for the Child and Adolescent Psychiatry Fellowship Training Program. Dr. Rollings, welcome to the podcast.
Thank you. Thank you for having me.
Our second guest is Dr. Vroman Stokes, who is a licensed clinical psychologist committed to improving the mental health of children, adolescents, and young adults. As the clinic manager at Forest Hills, Dr. Stokes oversees predoctoral psychology interns and leads quality improvement initiatives as the Child and Adolescent Project Coordinator. She specializes in the treatment of ADHD, mood and anxiety disorders, parent-child conflict, and phase-of-life challenges. Dr. Stokes, thanks so much for being here.
Thank you for having me.
Well, you both came highly recommended by Mark Eastberg, who is your president and CEO at Pine Rest. He's also an MHA board member, so we're just so grateful and really appreciate the time you're both taking to connect with our audiences and give us some more insight on what's going on at Pine Rest and what you're working on. So I also just want to say on a personal note, huge fan of your work. I'm in therapy, huge proponent of therapy for anyone who has access to those services to utilize them. And obviously on a professional level at the Hospital Association, we're really advocates for mental and physical health. So with that said, before we get into today's topic, I would love to learn a little bit more about your backgrounds. I know we gave some background in the intro, but maybe tell us what led each of you to this field and what you love most about working in mental health. Dr. Rollings, if you're comfortable, we'll start with you.
Absolutely. Well, no, first and foremost, I really love the patients and families I work with and getting the unique and important chance to hear them talk about, their most intimate successes in challenging and managing their kids and teens' needs. And I love working with children. They're just a lot of fun. They give me a chance to constantly think about how I'm understanding them and connecting with them. And I get to be more playful in my work, working with, a wide range of ages and working with youth. So I really love that. I also really enjoy supporting systems level of care. For example, I work with pediatrician offices and supporting them providing behavioral health care as best they can in their practice to their patients. As we know, pediatricians take the bulk of mental health treatment before they come into a specialist's office like ours. And so I think getting to be able to provide them with support gives me a chance to see my work have much larger impacts as well.
Yeah, that's a wonderful answer. What about you, Dr. Stokes?
Well, I think I'm going to echo much of what Dr. Rollings said, to share a little bit more about my personal passions too. As predominantly a child and adolescent therapist, I also have a unique opportunity to not only care for the children and teens that I serve, but the systems in which they live and function. So I very much value that I have this opportunity to care for the whole family system and opportunities to even support school systems at times as well, because we know that we can't effectively care for the kids in our community without also caring for the important adults in their lives as well.
Absolutely.
And so I very much value that opportunity to both support and educate, again, my kids, but also their caregivers and their educators as well. And it can be so rewarding to see their symptoms alleviate, certainly. Sometimes kiddos come to me because they're highly anxious or very much struggling with depression or, anger outbursts that can be quite disruptive at home or school. And it's fantastic to see that improve over time. but it's also such a privilege to support systems in improving as well. So having the opportunities to support, parents and kids learning how to communicate effectively, how to even enjoy each other's company again, particularly when there's been some, breaches of trust or ruptures in those relationships, and, just improving quality of life on a broader level. But similarly, like Dr. Rollings said, kids are just phenomenal to spend time with. I truly just delight in their company. I'll be honest. I mean, certainly working with adolescents for a living can be a challenge, but I value, their honesty and their humor and their sass. I think that there tends to be so much more laughter in the therapy room than people often anticipate. And that can be such a joy and a light in my day as well.
Yeah. And the work you're doing is really equipping future generations with an invaluable skill set to be able to not only understand, but articulate their emotional and behavioral health needs. So I wonder if you two would agree, but it feels like mental health is much less taboo of a topic in a lot of ways. Maybe not for every culture or generation, but would you agree there's been a shift in that way?
I would strongly agree with that. I think youth are, in my experience, outpacing adults with their willingness to explore topics around their mental health struggles that sometimes adults need a little bit of support. To Dr. Stokes' point, we got to help the whole family system. But I've been glad to see that shift. I think it hopefully signifies that we're a comfortable space, a space where they can come in and talk and get support and help earlier, certainly different than when I grew up. And we can get more focused on that preventative lens, as you mentioned. I think the earlier we intervene, we know the better outcomes for people's mental health journey. So I think that's really encouraging.
Absolutely. And even things like ADHD, I remember when I was in elementary school, people didn't really talk about it. It was not like a well-known thing, but my brother had severe ADHD, and there was one teacher who understood what it was and didn't look at it as, this is a problematic kid. They saw that he just had extra energy, and that simple understanding was like, it made all the difference. They'd write on a sticky note, Dominic needed to go for a walk, and hand it to him and say, take this to the office. And then the principal would open it and go, oh, okay, you can go back to class. So it's clinicians, and it's also just adults in the space, any spaces where children are present that understand that mental health is really important. So I appreciate you both giving some background on what led you to the field. And I think I would imagine that the mental health needs of any one individual or community varies across age, gender, race, lifestyle, and just general circumstances among, I'm sure, many other factors. But can you provide any insight on what trends you're seeing in behavioral health and what Pine Rest is doing to respond to those areas of need?
Yes, absolutely. I think before diving into the trends, when I'm having this conversation with folks, I think it's often helpful to first just pause and kind of reflect on what our world has experienced over the last few years. Certainly, all of us could and did experience, mental health challenges pre-COVID, but with the advent of the pandemic back in, 2019, the whole world really came to a halt, and everyone experienced really unique stressors and numerous transitions over the course of months and years, truly. And as you can imagine, and as perhaps you experienced personally, that resulted in a significant amount of stress. So families trying to navigate working from home while they also have a full household of kids that they're trying to support and doing remote learning. Folks who, might have still worked on the front lines and were not able to stay home, who are now very anxious about maintaining their safety. And folks who perhaps lived alone, who are now abruptly cut off from their support systems, who are now experiencing heightened levels of loneliness and, perhaps sadness, and aren't able to seek the same level of support and comfort that they might have otherwise. And, we were naive to think that the pandemic was going to last, 3 weeks, and then we could go back to normal. And,
Right.
here we are years later, and, COVID is here to stay. And so I think, unfortunately, those transitions and stressors have persisted for so long. We're now seeing unprecedented levels of mental health concerns in our community. And there are some individuals who are more vulnerable. So, for example, we know our youth were hit particularly hard throughout the pandemic. And in fact, the Surgeon General back in 2022 declared a state of mental health crisis for our youth. And adults are in that with kids too. We're seeing higher levels of psychiatric hospital admissions, higher incidence of substance use, and adolescents and adults as well. And so, we're at a place where we're seeing intense mental health needs, but we're also observing unfortunate trends where we're unable to keep pace in the behavioral health community with the demand for services.
Right.
So coming full circle then to what trends are we observing, I think we're starting to see an increase in the availability of online resources and supports. So I've been, reading and researching quite a bit about AI chatbots and AI apps that are really emerging as, I think, a response to the growing demand for behavioral health support. And with all things in life, I think there are benefits and potential drawbacks to those resources. I think because they don't proclaim to diagnose or treat mental health conditions, they're therefore not regulated by the FDA, which then means that we don't have much available data about the effectiveness of these resources. So on the one hand, we can certainly see the appeal in the sense that these apps are often free. They're often available 24/7. And for so many of us who are suffering and looking for guidance and support, it can be quite appealing to have access to some level of support and resources when they might not be able to connect to a behavioral health provider for more immediate assistance. But as you can imagine, there are potential concerns too, I think, particularly for us as mental health providers about these AI chatbots' ability to appropriately and safely respond to crisis and emergency situations. So it's something that I think us behavioral health providers are certainly becoming cognizant of and can understand why this came to be, but also have some concerns and reservations about how to safely meet the need that our community has at this time.
Absolutely. Have you heard any feedback from patients who have utilized some of those AI services in mental health care, or is that just from your own research and keeping an eye on? I mean, there are many conversations happening about AI care, but have you heard any feedback?
Not about the AI chatbots with respect to behavioral support. This is mostly coming from my own, research. However, I certainly hear about the use of AI in my team for other purposes, such as, writing essays.
Yeah, I was going to say, everyone's talking about ChatGPT, but I hope they're not using it as a therapist. But
I would say I've had two teams that did use ChatGPT.
Really?
One to say, unfortunately, just to underscore the access issue that Dr. Stokes pointed out, our access, especially in the pediatric realm, it's probably true for adults too, but in the pediatric realm, is just a huge issue right now, getting people in a timely way. And so kids and teens going to those resources are using ChatGPT in interesting ways. One teen, while they were waiting for their 3-month eval to get seen, to get therapy, they decided to look up, different ways to deal with stressful people in school. And the responses were very unhelpful to them.
Oh, no. I was hoping you would say they were good. Just take a deep breath.
It was like getting better sleep, making new friends, things that on surface might be fine and great. But for that individual who's already struggling, I think interpersonally, to find a community and people they felt comfortable with, who understood their anxiety. It was just a huge mess.
Right. And with anything, there's obviously pros and cons and nuance. So I think it's good to recognize that, well, ChatGPT and even maybe those simple tips might be really beneficial to one person. They might be not helpful at all to another. And we just have to be careful about how we're accessing information digitally and seeking care virtually. Sometimes needs to go beyond that. And I assume as two clinicians, there's some concern and maybe even frustration with the world of social media and how that's become a platform for a lot of information, a lot of misinformation about health and wellness. So I do want to say that I echo your points about how there's nuance and things like ChatGPT can serve a purpose and help with access and education. And even things like social media can be a great tool for community and better understanding, an experience you may be having or symptoms you may be having. But it's really important to take it beyond that virtual space when and where you can.
And I hope as clinicians, I'm going to say this being completely contradictory because I do not have a platform on TikTok. I do not use it, admittedly, but we got a charge from our ACAP, that's our National Child Psychiatry Group. There's a media committee that meets, and I sit on it. And they said, we need to be out there more because I think this idea that there are many experts giving advice on those media platforms is hard to compete with if we don't truly have clinicians giving perhaps, more grounded recommendations and ones that are aligned with evidence-based to support people seeking out those connections through TikTok and social media more.
Right. I think the new phrase is I read an article, but it actually means I saw a TikTok. And that's just one example of how that's going. But I did actually read an article that a lot of, and you can correct me if this is not accurate, but a lot of younger ages are thinking they have things like ADHD and Tourette's and these behavioral health concerns because there's so much talk on those social media platforms about those specific disorders. Are you seeing that? Are you having patients come in and say, I saw a TikTok and I think I have this?
Absolutely.
Truly, sometimes that is the referral question.
Wow.
Our testing psychologists see this regularly and brought that up recently at a meeting where the number of referrals they had for new diagnostic evaluations to understand if someone has autism had been really at an all-time high. And we already have long wait times to get that diagnosis. So they're wrestling with, okay, I have somebody who's kind of newly figuring out what their struggles are. They found community through TikTok and think perhaps they do have an autism diagnosis, which would be important to explore. But that's also competing with some of our very young patient population in the 0 to 5 age range who time to treatment and getting a diagnosis and testing is so crucial.
Right.
So they're trying to be thoughtful on how to triage those requests. But yes, they definitely have noticed that trend.
Yeah. Any other trends? Oh, sorry, go ahead.
Oh, sure. I was just going to say, Lucy, I think that speaks to one of your earlier points about how up-and-coming generations are combating mental health stigma, right? I think part of what Dr. Rollings is sharing here is that teens and young adults are more open to self-exploration than previous generations and are truly very interested in learning more about themselves. Yeah. And I do think that online communities like TikTok have created spaces where people really feel like they belong and really identify in those spaces and are seeking out information to help confirm or explore more about themselves, which can be a beautiful thing. But to Dr. Rollings' point, I think it's also contributing to significant psychological testing wait times because so many folks are seeking out the information, and there are some unique challenges that we're wrestling with trying to figure out how to support and honor that to the best of our ability, while also ensuring that young children who certainly would benefit from connecting to the services that they need to really grow and thrive. It's hard to do both simultaneously.
Right. And one of the ways that Pine Rest is improving access to those services for pediatric patients is through the Pediatric Behavioral Health Center that's being built, expected to open in 2026. So congratulations on that, first and foremost. But I saw on the website it'll include inpatient, specialty outpatient, urgent care, and telehealth services. So a very exciting resource coming. Can you take some time to tell us a little bit more about that?
Yes, absolutely. Well, we're really excited about that project. As you mentioned, it came directly from access challenges, from wait times getting children into the right services, from meeting with multiple community partners and even state partners and hearing interest and investment in getting better access for kids and adolescents and their
Mm-hmm.
families. So we've held many listening sessions. We've looked at our data and trying to understand who needs to be served here. We believe a true continuum of care is important. That's Pine Rest's mission, is treating people at whatever level of care they need. So this will be representative of that. We do, as you mentioned, have the whole range as a result from a walk-in pediatric clinic. We have that today for adults. We're really excited to expand that and do that for children.
Mm-hmm.
And then we also have our inpatient services, which we have today, but we're adding more beds. And we're specializing some of our beds for unique challenges that kids and teens present with. For example, we're looking at having some beds dedicated to children and adolescents with autism spectrum disorder that might be having a bit more difficulty regulating their emotions and behaviors. And for younger children, we know sometimes co-locating young children with adolescents doesn't always go as optimally as it could in treatment. And they like having their own space and even play equipment needs, for example, that goes into planning.
Mm-hmm.
We also have outpatient, so it'll be a 2-story building. So I'm kind of walking you through the roadmap in my mind.
Absolutely.
So on the second floor, we have outpatient clinics, and then we have day treatment programs, which can be really lovely for families and for youth themselves, because they can come during the day, get intensive treatment, take the time they need to get well again, and then practice skills and be in their home setting in the evening. So that's called our day or partial hospitalization treatment.
Okay.
We've also identified a need to have more focus on specialty treatment. So we're hearing gaps right now in our systems, both at the hospital level and community level, where kids and families can't get into the treatment they need specific to eating disorder treatment, substance use disorder treatment, and for kids with autism spectrum disorder, getting more specialized therapies for their needs.
Mm-hmm.
So we're going to be mindful of those specialty focuses and ensure we're embedding that throughout our center too.
Wow. Well, it sounds like it's going to be a really wonderful resource and access point. So I appreciate the background, and we're certainly looking forward to seeing everything come together. As you're opening a new facility, I would imagine that there's conversations around filling new roles. And we know that hospitals and health systems throughout the state and beyond are still really struggling with workforce shortages. But I do want to take a moment to touch on some of the opportunities at Pine Rest that exist for people entering the field. I know you're both involved in fellowship programs, but it sounds like there's a lot of educational opportunities for future clinicians.
Sure. We each have different fellowship focuses. Yeah. So for psychiatry, I run our 2-year child and adolescent psychiatry program, and that really came from that exact mission of we have workforce shortages across all disciplines, really. So I don't want to suggest psychiatry is the only one, but certainly one additional element. And that training program has retained about 50% of our child psychiatrists into the community, and many of them have stayed in the state of Michigan, if not within Pine Rest. So we've been successful in graduating 4 child psychiatrists a year who do go out into the community and work and are able to do exceptional care, which is really exciting. Alongside that, we have a nursing program that has been really exciting at Pine Rest that has taken our awesome nurses and providing additional training and supporting them through loan forgiveness programs as well. So just highlighting a couple disciplines, but that is certainly not the comprehensive list of some of the other unique programs we've been implementing.
That's amazing. And both of those programs sound really important. Dr. Stokes, any other programs that you would uplift?
Yes. So on the therapy side of the behavioral health spectrum, we do have our predoctoral psychology internship program, which has been well established for many decades now. This is the training that doctoral candidates receive as their very last year of training before receiving their doctorate in psychology. And here at Pine Rest, we have so many services that are available to the community. And so our interns have the opportunity to do a year-long training in outpatient psychotherapy, as well as have exposure running groups, doing psychological assessment for things like autism and ADHD. They also have exposure to our inpatient units and partial hospitalizations, and have opportunities to run groups supporting the adolescents and adults receiving care there as well. So that's a really wonderful training program, something I very much value being a part of. And that also serves as a bit of a recruitment tool, just as Dr. Rollings alluded to. We often retain a fair number of the interns who come through our program who then remain at Pine Rest for their fellowship and their career beyond graduation, which is really fantastic. And then we also do have a more newly developed limited license program for master's level therapists. So that might mean master's level social workers or licensed professional counselors who are also in need of additional supervision and hours to obtain full licensure. And so we're able to provide that support and training for those individuals who often tend to stay with Pine Rest upon receiving their full licensure as well.
Amazing. Well, it sounds like there's no shortage of opportunity at Pine Rest. So we'll be sure to include details in the description of the episode and links and all of that. But when it comes to retention and recruitment efforts, I would imagine that having those educational opportunities and programs and fellowships are really beneficial. But what are some of the barriers? And A, are you seeing those programs help? And B, what are some of the barriers that still exist?
Yes. And we also, Dr. Stokes and I talked a bit before this podcast, talked about the burnout rates.
Yes.
Unfortunately, many of our mental health clinicians experience are notably up and probably impacting their investment in the field too. Not to say that's, led to any people not choosing to come into these programs. I think they do, but I do think the burnout's there and worth recognizing.
Absolutely.
To hope through unique channels like providing loan forgiveness or providing support and supervision, educational programs that might alleviate some of those stressors to a degree as well.
Yeah. And I would imagine with virtual care, it's very much a double-edged sword in the sense that you're increasing access for patients, which is a wonderful thing. But you're also adding pressure to the workforce and our clinical staff. So would you say that any of the technology or virtual care tools that exist are alleviating your workload in any way? Is it providing new levels of flexibility that maybe didn't exist before?
I would say yes and no. I think, like all things, there are pros and cons to telemedicine. I do find, just like our patients, that therapists and psychiatrists value that flexibility. I think it's fantastic to have the ability to work remotely when, our family structures might, really benefit from that option. And certainly it's lovely to be able to provide that level of flexibility for our patients. And Dr. Rollings and I are both child and adolescent providers. And, for our work, I think we do find some unique challenges in utilizing telemedicine for the provision of services to that patient population, particularly the little buggers. Engaging young kiddos in telehealth services can be really difficult, right? I have very limited, if any, influence and control over the environment in which they're receiving those services. And there can be numerous distractions, right. In a home space that can really interfere with their engagement in that appointment. And so I think particularly during the height of COVID, when we were all working remotely, we were seeing particularly high levels of burnout for child and adolescent providers because it felt very difficult and draining to engage our patient population in particular. And I think we're seeing some of that improve as we can now get back to in-person work and have more variability in the delivery methods of behavioral health services, but it's tricky.
Yeah, absolutely. Dr. Rollings, how would you say telehealth has changed the landscape of behavioral health care?
Yeah, I would echo a lot of what Dr. Stokes mentioned. I think certainly having access to care has been lovely. We know that for children and adolescents, with access being so poor, especially in rural communities and communities that have to travel a lot further for their healthcare, it can be really wonderful to have that as an option and a modality. So I previously, when I did only in-person work, would see some kids who would travel even from the Upper Peninsula physically into the clinic because they could not otherwise get the care that their child or adolescent needed. And now today we can hop on the video call and talk more quickly about their needs. And the parent doesn't have to take off the entire day of work. They don't have to miss their entire day of school. I mean, on one hand, they were using the trip to Grand Rapids to go to have lunch and do bonding activities, but I think we'd all agree it was pretty disruptive to their daily life.
Right.
And this has been a really nice ease for patients and families. But also to Dr. Stokes' point, I think there can be those challenges engaging, especially as you mentioned, with younger children. And even sometimes our adolescents, for example, with autism spectrum disorder, their preference to engage over a virtual platform just may not be the same as their neurotypical peers. So they may find it harder to, intensely focus on another person and maintain eye contact and be very present for a verbal dialogue over a video screen. Where in office, we'd probably get on the floor and play a game and have ways to not use all of our verbal skills together to help them feel more comfortable in that dynamic. So I do think, I think there's the pros and cons. I had a patient recently whose the mom's car broke down. She would have preferred to be in person, but it was lovely for her to jump on the video screen. So again, just the ease balanced in with making sure we can use the platform to engage really well with the patients we're working with is important.
Right. Of course. Yeah. And in addition to the hurdles and challenges that you're seeing in this space, I wonder if you could take some time to elaborate on how you've seen the infrastructure of behavioral healthcare shift with new technology, and any lessons learned that you would pass along to other hospitals or clinicians.
Well, I think Dr. Rollings alluded to some of those challenges. We were talking prior to this in preparation, and both agreed that we're seeing telehealth resulting oftentimes in a more casual approach to treatment than was the case when we all met in our offices routinely for behavioral health appointments. And so in one way, as Dr. Rollings just mentioned, it's lovely to have that flexibility. We don't always have to cancel appointments now when emergency situations arise or, the universe conspires against us, to make those appointments in some, interesting ways. However, the flip side to that is that I think many of us providers are recognizing that we're straying a bit from how we used to prioritize those appointments. And so, for example, sometimes I'll hop on a telehealth call and the whole family will be bundled in the car together, traveling from school to an extracurricular activity. And mom will be passing the phone on back to kiddo. Here, talk to Dr. Lisa.
Oh, gosh.
You might have a kid, teen or adult lounging in bed, engaging in substance use while engaged in treatment with you. And so, I think this is a challenge as providers where we're finding ourselves in this position of re-educating and acclimating our patients to how they can most effectively engage and benefit from treatment. And because it is so easy now to do telemedicine, there's I think this preference, to multitask and sneak it in our daily activities. And there certainly are drawbacks to doing so. And so we're having some conversations trying to, again, re-educate and acclimate to how we can most utilize mental health care.
As providers, you have to set your own boundaries. You have to, set expectations for your patients. And I'm sure that's hard. Not to use a therapy term that I know is really a buzzword right now, setting boundaries. But I think it's appropriate. It's appropriate. It's something that you have to do. So I appreciate you both touching on some of those. Dr. Rollings, anything you would add to that end?
I do think, from my work as a physician, there's also a medical component that can get really tricky over telehealth. So if I'm prescribing medications that have impacts for children on their blood pressure and heart rate. I would really like them to come in for medical screening, yet I want to be flexible to offer telehealth to meet their needs too. So I think at the beginning of sessions, you ask kind of what we're doing to address this. I think having those discussions early on and setting the stage for how will your treatment plan look, much like we would even if virtual was not the topic of conversation, but here's your treatment plan. We are going to meet in person, at least once every 6 months. And then we're able to do virtual in between. And here is why. These are the labs or the medical pieces that are necessary for your care. And I do think, just speaking broader to working with kids and teens, they deserve some confidentiality in their work. Of course, we want parents aware of what's going on, but I think kids are going to be more open with us and more, especially our teenagers, and more engaged in treatment. They know they have a confidential space. And that is just extremely challenging to secure through a telehealth connection at times, even with their best efforts and with families' best efforts.
Right. That's a good point. Well, to switch gears just a little bit, I know Pine Rest was one of our grant recipients of funding that was appropriated by the Michigan legislature as a part of last year's state budget. And just for background, that program was really designed to increase the number of beds that are available throughout the state for pediatric, psychiatric patients, and those that require inpatient hospitalization specifically. But I want to ask the two of you, how can our policy leaders at the state and federal level, in addition to funding of that nature, how can they support the behavioral health infrastructure and our providers in this space?
I can set the stage. I was just reflecting on how you framed it, Lucy, in addition to funding. And I think that's such a big piece of it, though. And in reflecting on this, I think that I'm hopeful, and I think Dr. Rollings is too, that we're at a time in our history where there can be a bit of a reckoning for how we fund and support behavioral health care in our communities. We've already touched on this, but behavioral health needs are at an all-time high for our youth and for adults, and certainly have even been declared to be at crisis level for some vulnerable populations, adolescents and children in particular. And this is all resulting in increasing demand for services, resulting in increased burnout for our healthcare professionals, certainly for behavioral health professionals. And at the same time, we're also observing limited, if any, increase in reimbursement for services. Yeah. And I think it's important to note that there is some emerging data that demonstrates having improved access to behavioral health treatment can reduce emergency department visits, inpatient stays, and just overall healthcare costs for some patient populations. And relatedly, we also know that an individual's mental health does have implications for their ability to care for themselves medically and more holistically. It also has implications for their ability to feel safe and comfortable seeking necessary medical treatment. And all of this can result in downstream increased healthcare costs. But without that sufficient funding and that support, we're finding that it's increasingly difficult to provide really effective behavioral health care while also covering our costs. And so, we are looking to our policy leaders for support and advocacy in that way.
Right. I think that's really well said. Dr. Rollings, anything you would add?
So well put. I think our supporting avenues, as we talked earlier about programs that we have for workforce shortages and supporting workforce development, I think is really crucial and important in order to have the work staff that we need to respond to the crisis effectively. And then to Dr. Stokes' point about the reimbursement, I think that is a really critical area that needs more investment and more support whenever possible. In behavioral health, I'm thinking specifically through an inpatient lens, but sometimes we treat children, adolescents when they're at their hardest struggling points, and they need a lot of support, and they need a specialty team to really provide a lot of services. And I think reimbursement could, for behavioral health, follow a model like it does in medical health, where if you're at the highest level of care, for example, an ICU bed, you get a different rate because your needs are more specialized. You need a different team. You have more intensive work needing to be done. I would love to see that mirrored for the complex needs we have for our patients. It would be really wonderful if our children who are struggling with more complexity, either diagnostically or in their symptoms or in their systems that they live in outside of the hospital, require more teamwork and more specialization, that we have rates that can support us in providing that work. I think that's one crucial area. And the last I'll say is I think more funding around preventative models of care, as Dr. Stokes identified, the more that we are intervening earlier, the less the healthcare costs and physical burdens, develop for our patient populations down the road. And I think we need to change this whole, we're in crisis and now access is so bad that we're in a crisis response mode rather than a preventative mode. And so I think anything that helps us shift back to getting more access earlier, bringing it into places where kids normally are going to experience their community, such as schools or pediatricians, I think is really critical too.
Absolutely. Absolutely. And I know that's a really big question. So I appreciate you both taking the time to touch on some of those areas that still need some more support and attention. And I would just add, if there are lawmakers in the area, visit your hospitals, visit Pine Rest, go on site and hear from your clinicians and your healthcare leaders, and just take the time to better understand what's happening in the care space and in the behavioral health care space specifically. So I think there has been so many wonderful takeaways from this conversation, and I'm really excited to share it with our listeners. I just want to close things out by asking both of you what message you would leave with our listeners during Mental Health Awareness Month, whether it's a message for clinicians, hospital leaders, or just the general public. And whoever would like to take that first, go right ahead.
I think my message for clinicians and, the general public are somewhat similar in the sense that, if you are burned out, if you are overwhelmed and struggling, you're certainly not alone, right? And we've got so much, anecdotal, information that supports that and hard data that supports that as well. Despite living in this quote post-COVID era, we are still struggling with the implications of what our world experienced early on at the onset of the pandemic. It's taken a significant toll on all of us. And I have observed in my colleagues and in my patients and in myself, kind of a lessening of resilience and coping with everyday stressors, because we've had years of significant stressors and transition. So I just want to speak to that and to validate that you are not alone in those experiences. You are seen, in all of your heroic efforts to care for your communities, to care for your families, to support your children, your spouses, your friends. These are still difficult times, and there is support out there. I know it sounds a little bit doom and gloom. We've been talking about, demand for services and, the lack of infrastructure and supports to meet that growing demand. But there is help available. Pine Rest is, still able to accept, new patients into the system for psychiatric care and therapy services, and certainly other agencies and providers across the state are as well. So if you are struggling, whether you are a clinician yourself or whether you are, a member of our community and you feel like you could benefit from additional support, please reach out. Dr. Rollings and I will provide contact information for Pine Rest specifically. We do have an access center that is open 24/7 and able to receive phone calls from our community, from folks who are trying to seek services from themselves or for their children. And we are more than happy to, meet you where you are at and support you in that journey.
Absolutely. I echo everything Dr. Stokes said. We're here, we're available, we have services. Call sooner rather than later. I know sometimes people wait, and sometimes early signs are a good time to get in as well.
Absolutely. I think that's a wonderful message to end on. I want to thank you both again. This has been such an insightful conversation. And again, I think there's just so much to take away. So thank you both. Anything you would add? We're going to include links to all the resources that are mentioned, and we'll include, just general contact information as well for anybody that wants to get in touch. But anything that we didn't get a chance to touch on that either of you wanted to uplift?
I was thinking when you mentioned the programs, I didn't even name the nursing program that we have as our Nurse Academy. So it's allowing people to go through and get their nursing degree with support for that schooling education and then loan support too. We also have an APP program, a training program, which allows advanced professional practitioners to come through. That could be a physician assistant or a nurse practitioner, and they can come in. So they've already had those degrees to come in to get specialization in behavioral health, so they get additional training to feel confident working with those patient populations. We have an adult training program, and we're expanding and providing child training for our APP program too.
Perfect. Yes, the Nursing Academy was actually featured in our 2023 Community Benefit Report. So I appreciate you mentioning that. And we have more details both in the report and on our website at mha.org. So thank you both again. I really can't emphasize how appreciative we are of your time and expertise and of the work that you do every day to help Michigan patients and communities. So thank you for being here.
Thank you so much.
With that, I'd like to thank our listeners for tuning in. And as always, we'll include details from today's discussion in the description of the episode and encourage anyone who hasn't to subscribe to our podcast or visit mha.org to learn more. To learn more about Pine Rest, you can visit pinerest.org. Thanks for listening. We'll be back soon with another episode.